White House to St. Louis County are urging people to still get vaccinated while the feds investigate 6 incidences of blood clotting after patients received that Johnson & Johnson vaccine. News 4's Emma Hogue spent the day gathering reaction. She's live from the St. Louis County Health Department in Berkeley tonight. Emma.
Sam, right now the St. Louis County Health Department, like just about every vaccine site, is only using the Moderna and Pfizer vaccine. But really important to put these numbers into perspective. You're more likely to get struck by lightning than you are to develop a blood clot from this vaccine. But even with that statistic, the health director here still worries some may opt out of getting a vaccine altogether.
My grandmother, she actually ended up losing a leg. Blood clotting is a very prevalent thing in my family. So I feel like it's a risk no matter what medicine I take, no matter what shot.
Even with a family history of blood clots, Kelly Ettinger wasn't concerned after getting the Johnson & Johnson vaccine. After hearing the news today, she says she wasn't worried for herself, but saddened to think this may deter others from getting a shot.
I felt like people were going to back away now and be scared to get it.
I was a little apprehensive about it because it was just approved a lot faster than most.
After debating for weeks, John Gates decided to get the Johnson & Johnson vaccine on Sunday. He says the majority of his family isn't getting the shot, and this only validates their concerns.
If they had any chance of getting it before, I think after this, I really highly doubt they're going to get it.
Everything we do in life, including healthcare and vaccines, is always a balance between risk and benefit.
In this case, Dr. Faisal Khan with St. Louis County Health says the benefits of the vaccine greatly outweighs any potential risks. Out of 100,000 vaccines, the county has distributed less than 2,000 J&J shots. Khan says there's no need to question the safety of vaccines.
This is not a cause for alarm. This is not a cause for people to hesitate to get the shots that are available to them. This is simply the regulatory agencies and the premier healthcare agencies, public health agencies, intervening to make sure that we minimize the risk even further.
Dr. Khan says the county's distribution plan will go on as planned. In the past, they reserved the Johnson & Johnson vaccine for the homebound and the homeless. Now they'll have to make 2 trips to those people. Today, I spoke with another woman who got the Johnson & Johnson vaccine last week. She's had symptoms that have lasted about a week now. She went to her doctor to get it checked out. You'll hear from her coming up tonight on News 4 at 6. Reporting live in Berkeley tonight, Emma Hogue, News 4.
Interested to hear about her experience, Emma. Thank you. Doctors say the concern that put that Johnson & Johnson vaccine on hold are over a very rare occurrence. Here's a breakdown of what that looks like. There have been 6 reported cases of blood clots out of more than 6.8 million doses delivered. 1 woman has died. All 6 cases occurred in women between the ages of 18 and 48, and their symptoms developed 6 to 13 days after getting that vaccination.
And for those who have gotten that vaccine, here are the symptoms to watch out for: severe headache, leg pain, abdominal pain, and shortness of breath. Pandemic Task Force leader Dr. Alex Garza says it's important to look for those symptoms, but also says don't freak out.
And there's many other things that you do in regular life that have a much higher probability for a poor outcome than this. And so I would say keep an eye out for those signs and symptoms, but understand that the risk is, as we know it right now, is still really, really, really low.
And Dr. Garza added that a person is much more likely to get a blood clot from actually getting COVID-19 than from getting the vaccine.
New at